What is schizophrenia? Schizophrenia is a rare disease affecting around 2 million people over the age of 18. Although schizophrenia is considered to be a rare disease, it is commonly studied by psychologists due to its wide variety of symptoms. Psychologists have been able to break down the key reasons why a person might develop into a schizophrenic mindset, the first being family genes. Patients who have had a history of schizophrenia in their family are more likely to contract the same genetic makeup for a schizophrenic patient. The second reason is the environment and family. If your family has a history of schizophrenia, you are more likely to inherit the disease. For example, if you were a twin and your twin had the disease, you are 65% more likely to inherit the disease. The last reason is the imbalance of brain chemicals. The main reason for schizophrenia is the imbalance of dopamine and glutamine in the brain, causing the patient's neurotransmitters to not communicate correctly. Not all schizophrenia is the same. There are a variety of subtypes, with the most common being paranoid subtype and disorganized subtype. The most common symptoms of basic schizophrenia are hallucinations of voices inside your head, delusions that make you think other people are controlling you, thought disorders disabling you from socializing, movement disorders allowing you to sit still for hours at a time, lack of pleasure, memory problems, and a very shy personality. The paranoid subtype is the easiest subtype to control. In special cases, the patient can sometimes even live a normal life if they learn how to control it well enough. The most common symptom of being paranoid subtype is the feeling of a deeper conspiracy about every situation. With that being said, paranoid subtype patients tend to be very open about their thoughts. The disorganized subtype is not as easily as manageable as the paranoid subtype. The most common symptom is the inability to organize any type of thought process. Disorganized subtype can sometimes allow you to forget to do daily activities like brush your teeth or put on clothes before you leave the house. For that reason, most disorganized subtype patients do not leave the house often and develop an inability to communicate correctly.
What is bipolar disorder? Bipolar disorder, also known as manic depressive illness, it's a brain disorder that causes unusual shifts in mood, energy, and activity levels. It is very different from normal ups and downs, and many times it results in damaged relationships, job and academic performances, and sometimes suicide. It develops in late teens or early adulthood, and initially symptoms seem like separate problems, and symptoms are not recognized as part of a larger problem. And bipolar is a long-term illness and must be carefully managed throughout a person's life. So some of the symptoms of bipolar disorder includes mood episodes. It is a cycle between intense emotional states and extreme changes in energy and activity. And the manic episodes of bipolar disorder includes overly happy and outgoing, jumpy, weird, irritable, agitated, easily distracted, sleeping little, unrealistic belief in own abilities, and some depressive episode of bipolar disorder symptoms are long period of feeling worried or empty, loss of interest in life's activities, feeling tired or slowed down, some changes in eating habits and sleeping habits. Types of bipolar disorder are bipolar 1 and bipolar 2. So bipolar 1 disorder is defined by manic episode lasting at least 7 days. It's depressive episode lasting 2 weeks, and clear difference between mood episodes. Bipolar 2 disorder is depressive episodes shifting back to hypomanic episodes. It's not a full-blown manic episode, and it's more depressive in nature. Treatment of bipolar disorder includes medications like mood-stabilizing medications, antidepressant and antipsychotic medications, family therapy, and psychoeducation.
What is depression? It is a feeling of sadness that does not go away, unlike regular sadness. Someone who has depression can have symptoms of sleeping more often, becoming unmotivated, and have a feeling of hopelessness. Depression has variations such as major depression, minor depression, postpartum, and seasonal. Major depression can be the most severe. It affects the quality of life of the individual. Minor depression does not have as much of an impact as major depression, but the symptoms are still present. Postpartum depression is experienced by mothers after childbirth. Seasonal depression affects individuals during different seasons, winter having the highest depression rate case. Diagnosing depression can be difficult. A doctor must rule out other sicknesses and refer a patient to a mental health specialist. The specialist will issue a mental health evaluation. This can include family history, current psychological state, and history of drug abuse. Various illnesses can coincide with depression, such as PTSD. Mental health professionals use different therapies to help individuals with depression. Often they introduce medication to combat the effects of depression. These medications can include Prozac, Zoloft, and Lexapro. It usually takes 4 to 6 weeks for medications to have a noticeable effect. The FDA has a black box for all antidepressants, warning the public that these medications can lead to increased suicidal thoughts. Men and women experience depression differently. Men have increased irritability, loss of interest, and trouble sleeping. Women have increased guilt, feeling of worthlessness, and sadness. Treatment between men and women varies because of this. Men are more likely to self-medicate with drugs rather than women.
Conduct disorder is major behavior problems that are not considered age-appropriate nor conform to social norms. Behaviors fall into 4 categories: aggressive conduct, non-aggressive conduct, which is property loss or damage, deceitfulness or theft, and serious violation of rules. Behavior causes problems in school, social, and work settings. Symptoms of conduct disorder vary on the age of the child and whether the disorder is mild, moderate, or severe. In general, symptoms of conduct disorder fall into 4 general categories. Aggressive behavior. These are behaviors that threaten or cause physical harm and may include fighting, bullying, or being cruel. Destructive behavior. This involves intentional destruction of property such as arson, deliberate fire setting, and vandalism, harming another person's property. Deceitful behavior. This may include repeated lying, shoplifting, or breaking into homes or cars in order to steal. And the last one is violation of rules. This involves going against accepted rules of society or engaging in behavior that is not appropriate for the person's age. These behaviors may include running away, skipping school, playing pranks, or being sexually active at a very young age. In addition, many children with conductive disorder are irritable, have low self-esteem, and tend to throw frequent temper tantrums. Some may abuse drugs and alcohol. Children with conduct disorder often are unable to appreciate how their behavior can hurt others and generally have very little guilt or remorse about hurting others. There are 3 major ways to treat conduct disorder: community-based interventions, family therapy, and medication. Community-based interventions are sometimes called wraparound services to describe the intention that they will be brought to the child's natural environment in a comprehensive and flexible way. The idea is to target a range of child, parent, family, and social system factors associated with a child's behavioral problem. This approach has been successful in modifying the child's behavior. Family therapy is also used to treat conduct disorder. Parents learn to apply behavioral principles effectively, how to play with their children, and how to teach and coach the child to use new skills. And last but not least, medication is sometimes used and may be effective in controlling aggression. Generally, a variety of treatment modes are used to address such a complex disorder.